All right. Welcome to another episode of season 3 of Dr. G at the Heart of Healthcare. Today is so exciting. I've been wanting to cover the topic of pet loss for a very long time. And our death doula friend, Francesca, introduced me to one of her friends, Dr. Ken, who is a vet. And we're just going to unpack a lot of things today. So, welcome to the podcast.
Hi, everybody.
All right. And then remind me how to pronounce your name. I do not want to butcher it.
Sure. Yeah, my name is Gorczyca, and my
Oh, of
father
course.
was a physician. He went by Dr. G as well because you can't really
Okay.
pronounce my name, so I feel really connected. But Dr. Ken's fine with me.
Well, we're double Dr. G, but I can do Gorczyca because my first car was a Corsica. It was,
That I always say it's like the island. Yes. So
yes. Okay. Well, welcome, and audience. I believe that hospice is the heart of healthcare. I always tie some of our topics into end of life healthcare, but our pets are very important to us. Bella is sitting here at my feet, and the pets bring us so much joy. Even in healthcare, we have pet therapy, bringing a lot of beautiful things to folks. But we all have to face the end of life for pets also. And so, me as a pet parent, I wanted to cover this topic just to reduce my anxiety about it. And Dr. Ken or other Dr. G here, has a mission to bring spirit into the industry of vet. I'm getting tongue tied. The veterinarian industry. So I'm just going to open the floor for you. Where do you want to take us? Where do you want to start, Ken?
gosh, yeah, I'm so glad to be here, and I appreciate Francesca's connecting us. I think that we're kindred spirits in a way, and I I guess I can just start with my own story. Would you like that?
Yes, you are the
And
story.
okay, well, I went to school at Davis in California, and I graduated in 1983, and I ended up practicing in San Francisco, in the heart of the city. And it was right at the beginning of the AIDS pandemic, the dawn of the AIDS pandemic, and so little did I know that a human illness would affect my career path, and so in practicing in the heart of the AIDS pandemic, a lot of people, of course, have pets, and so as a veterinarian, I was getting asked about end of life issues, but also there was a lot of the physicians at the time were very, the virus was unknown. They were fearful of what could cause AIDS. And people with AIDS were developing a lot of diseases that could be also transmitted from pets, like toxoplasmosis, salmonella. I mean, there was this whole range of diseases. And so to be on the safe side, they were telling their patients to give up their pets. And this is at a time when they're dying. And it's really was, and as a veterinarian, I felt that the human animal bond and animal companionship was so powerful that it was pure medicine. And that was not really necessarily going to be the best way to go. And so I ended up helping to create the organization Pets Are Wonderful Support, where we supported people that were dying of AIDS to keep their pets through volunteerism, through fundraising, through education. And my focus was on education and how to educate the physician and the veterinarian that pets were okay. In fact, they were pure medicine. And so that was my start. And it turns out, when I look back, I didn't realize that I was being a doula, a death doula for my clients. I lost over 300 clients over those first 10 years, and dozens of friends and colleagues. And so all of us in San Francisco or in these communities were being death doulas, and we just didn't know the word, and it wasn't until later in life that I realized, oh my gosh, that's what I've been doing. And that just pulls me then to my end of my career. And I was trying to figure out what would be my next step. And I realized that that death was really part of my fiber and my life. And I went out into Death Valley to do some vision fast in nature and do your own metaphorical death. And it came to me that I wanted to work with the death of our companion animals. And so I did some Google searches, and I found the University of Vermont Companion Animal Death Doula Training Program. and also the companion animal euthanasia training academy. And I signed up for both immediately. And very quickly, I connected with a good friend of mine, Dr. Ari Ruzicki, who had started a Gentle Rest in San Francisco. And I realized on that first visit with him that this was going to be my calling. And so for the past 3 years, I've been helping to euthanize animals in the San Francisco area. It's been a real privilege to be brought into people's homes. I do in-home euthanasia. It's a sacred moment. And so I try to bring in spirit, ceremony, ritual to acknowledge this. And so we can talk about that later. But that's what brought me to this moment.
Oh, that's beautiful. And thank you for connecting it to, something we all know about, the AIDS epidemic. And, in hospice care, we don't see very many patients who have HIV and AIDS because, the medicine has gotten so good, after all these decades. But it's all connected. Wow. Let's just dive right in. I'm gonna take it by the horns. Let's talk about our pets. That was interesting about them thinking that pets needed to be separated from their sick owners. But what's interesting, or what I'm curious about, and I want to learn from you is, when we have to walk that road with our own pets, like, we know they have their lifespan and all that.
Yeah, no.
Like, I want to know about that, and like the home euthanasia and all that stuff for pets, because that I'm just really anxious about that. So I want to go ahead and get that out the way.
Sure. Yeah, no, I think that again, it's a privilege to own an animal companion, and we get so much love and understanding and pure medicine from them, as you know yourself. But their life expectancy is shorter, and so we are going to eventually end up coming to the end of life, and that's really where I'm focused. And it's a difficult thing to go through. It can be also beautiful. I know from my last dog, Teva, she lived to be about 16. She was a terrier, and as she got into her last 6 months, she was frail and losing some fur, but she was so beautiful. I mean, there was still so much spirit and love that she could offer. Just that we had to slow down and accept that, accept the ending. And it was hard for me because I even though I'm a veterinarian, I wanted to keep her, as healthy and comfortable, and she had kidney failure, and so I had to deal with that type of issue. And I remember once I took her to my mom's for Thanksgiving, and she was not at the table, and that is so unusual for Teva. She was always looking for handouts, and she was in the bedroom. She was alone in the dark corner, and I realized she was talking to me, that there was something major change in her life. And that's a lot of times when we have our animals, we as pet parents, we know them so well. We're with them 24/7, and so we can sense that there's changes. And of course, we take them to the vet and try to see what we can do to help them. And that in modern day veterinary medicine, we have palliative care, hospice care, just like in human medicine. And most veterinarians are palliative care vets and hospice vets. That's what they do as your general practitioner. But there are specialists as well. And in my case, I brought her home and I was treating her for kidney disease, but she went into heart failure overnight. And so I had to rush her to the emergency room, and there was no way that I was going to leave her there. She collapsed. So I realized I had to euthanize her in that moment. And that was okay, because that sometimes is the way. You can't plan everything. You can't plan the death. Death is like a birth, and it sometimes can be smooth. It can be bumpy. And in her case, I had to let her go in that moment. I've had other animals where I know that they're telling me they're ready. My last dog, or one of my other dogs, Igora actually, we were up in the country at a house, and she walked out the front door, down the driveway, through an open gate, which she had never done before, into the forest. I was watching her. And so I knew at that moment she was telling me that she was ready to leave me. I mean, her body had given out. She had cancer. And and so at that moment, I took her back, and I had my friend Kathy Gervais come over, a veterinarian, and we did a home euthanasia in her garden, where we were able to release her spirit in a very ceremonial, kind way. I kept her body overnight in vigil, with candles and flowers and incense, and I was able to respect that life. So those are the two sides. You can, and you can't always plan them, but there's a lot of, I think many people go to their veterinarian in the clinics to have euthanasia, and that's absolutely fine. Sometimes you have to go to the emergency clinic. When there's an emergency, you can't wait. And then there's now, just as in human medicine, where we're now dying more back in home through hospice, it's the same happening with our animal companions. And there's now a whole movement of in-home euthanasia veterinarians across the country that help clients with their beloved during this moment. So, and that's where my niche is. I try to help people, and it's a privilege to be brought into someone's home for that. It could be but it could be at the beach. It could be in someone's in a favorite park, in their garden. There's so many different variations on that, and we sort of allow the client and the animal to determine where we release their spirit.
Release their spirit. You're dropping a lot of vocabulary, phrases, and gems here. When I release this, I'm gonna have to, put that in the show notes. Wow, that's resonating with me. Releasing their spirit. Pet is medicine. It could be beautiful. All these things I'm hearing you say is, you and I deal with this every day. It's a privilege to be in someone's home. How can we get individuals, your clients, my patients' families, or peripheral folks to embrace that? Because people are afraid of death, just like I'm having anxiety about, pet loss.
Oh my gosh.
How do we normalize it?
That's probably the biggest question in our modern society, about acceptance of death. In the ancient times, or even in the Middle Ages, I mean, people accepted death was happening on our shoulder all the time. People could die, and so there was books written about how to have a good death, how to, what do you need to do to prepare for death. In our modern world, when we moved back to the hospital and died on a bed in a nursing home, we lost that, and now we're starting to come back with hospice. My father died at home in hospice, and it was probably one of the most powerful experiences I had as a human, to be with my mother and my siblings and the niece and nephews, and to be there for his last breath, and it was unbelievable. And I if people can have that experience, I think it's something that will be with you forever, in a positive way. There's one story I do tell about my father, Casimir Gorczyca. He was called Dr. G as well. He was a cardiologist. And I remember he was already unable to speak. He was in the dying process, but he had a pet conure, and he loved pets. He had cats, and he box turtles as a kid. He pigeons. It was, never ending. And I brought his conure into his room. He's in his hospital bed in the bedroom, and his last emotion was a smile, looking at that bird. And I'll never forget that. That was the very last time he responded to me and to anything. And so I think that shows you the power that animal companionship can have, even with the dying person. And so I think a lot of times, if possible, and I'm so grateful that a lot of nursing homes allow pets now to come in and be part of that process, and it's good for the animals to experience a death of their owner. I think that it's part of they understand death through energy and scent in different ways than we humans do. We take on the emotion through the heart and the sadness, but animals also grieve, and I always tell my clients to just to offer, to allow them to have that experience at home if you can with the pet, but then to allow them just normalcy, just offer the same routine and love, because sometimes they will grieve, if they're the best buddies for all these years. It's a hard change, and sometimes the animals become happy to be an only child, and they change into this new loving creature as well. They take over that lap that maybe the other cat used to take. And so there's a lot, I find that there's a lot of there's just a lot in this moment of endings, and Yeah. So I don't know if that I can talk about the actual process. Maybe that would be helpful to people. Do you think?
Yeah, yeah. Go ahead and talk about that because I was going to ask about the death doula program that you mentioned, and just your whole. I'm just trying to follow you because you're the artist that you're creating this whole masterpiece, and so I just want to follow.
Sure.
Um, yeah,
That no,
go,
that sounds
just
good.
go.
Yeah, I think that one of the issues for all of us with pets, is we don't know what to expect, and again, we're fearful of death. And so I think it's really important to be transparent. On our website, at A Gentle Rest, we describe the process. And one of the studies that was done recently was looking at websites of all veterinary clinics. Only 20% of them discussed euthanasia on their website. So I think that even as a general rule, we're all fearful of that. But I think transparency is really helpful to the client and to the veterinarian and to the animal. So in our case, we have two staff members that they answer phone calls and they talk to the clients, and they are able to get a feel for what's happening. And a lot of times people, aren't sure. They have to work with their own veterinarian to try to find out, if there's more that can be done, or are we at the end where it's not fair to do any more treatments, or just like in people, we sometimes push our animals and people way too far in this world, when they would be better off to allow for a natural ending. But what I do is I try to bring in storytelling. I sit down with the client and the animal, and I want to learn the whole life story of how they met, how they got their name. Did they are they a lap cat or a snuggler, or are they a foodie? Have they stolen the turkey off the table? Have they ever gotten lost? Do you dress up for Halloween? Do you what was your most favorite day? Did they, things like that? And I find that that's a really powerful tool for people to then become in the moment, realize the amazing love story they have together, and
Yes.
so that really and then after that, then when we're ready, we offer the animal a sedation injection, and that includes an opioid for pain control, and it includes an anesthetic, because basically we want to put the animal into an anesthetic state so they have no anxiety, no fear. It's just like you're going into surgery, and so
Mhm.
you're unaware, and if they're still eating, sometimes they are, that could be cats or dogs, then we offer them some of their favorite treats. As we give that injection, it gives them pleasure, distraction, and that could be a beautiful experience, sort of the last meal. I even, suggest that a dog can have chocolate, at that meal, anything. I've seen cake, In-N-Out burgers, they go on and on. You try to have a great last day. Sometimes you go to the park, you go to the beach, you just do all these favorite things. It takes about 5 to 10 minutes for the animal to go into a deep sleep, and the client is, or the pet guardian is there next to them. They could be holding them or being right next to their body, on a bed or on the floor. And then once they're ready, or completely asleep, then what we do is we tickle their toes, and if there's no reflex, that means they're ready for the next medicine, and that's the stronger medicine. It's a barbiturate, and basically it goes into the bloodstream and causes the body to turn off. The brain gets turned off, and then the breathing and the heart, and that's a lot quicker. That typically only takes several minutes. In my practice, after they passed, I ask the clients, is it okay if I offer a ceremonial ritual at this moment, to acknowledge the love that this animal has had in your life? And I'd say most people are okay with it. There's a few that say, well, I'm not religious. And I explain, well, this is not a religious ceremony. It's just it's a rite of passage. We're acknowledging this moment. And I ring some bells. If it's okay, I use some sage or sandalwood, and then I repeat the life story of that animal in that moment. Just to show this whole arc of where we are, and that the ending is just one part of this whole process. And to be at home is a privilege if you can do that. But wherever you are, that's a privilege. And then I will. read a poem, perhaps. I offer a rose quartz so they can remember this moment in their hearts, and then I close the ceremony. And at that point, I encourage the owners to be with their beloved, and they can have as much time as they want just to be present. Some people like to sit there and brush the animal. It's like this. It's like just respecting this moment, and in some cases, like in my own case, I kept the bodies overnight in vigil, and there's nothing wrong with that. In fact, it's a powerful opportunity, and some clients will do that. And then once they're ready, then we wrap them up in a shroud or into a blanket, or if it's a cat or a small dog, we put them into a basket and cover them with a blanket just to give them some what looks comforting. And we then take them back to the vehicle, where they then go to the back to the office, and they'll go to the crematorium typically to be cremated, and or some people keep their bodies and bury them at home. There's many different ways, and so that's basically the process. And I think that pet loss, though, is very powerful. It's one of the most difficult things we do as humans, because we are so attached to our pets. It's even deeper than sometimes with humans. Because they're unconditionally loving. They don't judge us. They're just happy to be with us. And so that's what makes it so hard for us to release them. I hear clients say, I feel like I'm killing my animal, and it's not that at all. They're in the dying process, but we're helping to facilitate a good ending. Some people, there's a whole movement of natural death, and I understand that's okay. Sometimes it could be a peaceful ending, but sometimes it's not, and so you have to have a plan B always. And that's my discussion. So yeah.
Oh, that's fantastic. Thank you for walking me through that, and our listeners through that. You often hear, well, I've had a couple, acquaintances, friends lose pets and share, their experiences. Or, I had an old friend who delayed, the euthanasia for, a dog that could barely, walk around, and he was having, severe arthritis, osteoporosis of the hips and all that stuff. But you often hear people, one, delay. So that's one thing I want to touch on maybe a little bit more. And then afterwards, I hear people say, I can't get another dog. I want to explore that. I had a grief
Sure.
counselor on the podcast before, and her definition of grief is when love meets loss. And you mentioned, they give us so much unconditional love, and they're just happy to be with us. And so that's why it's so hard. It's like, if I had to describe it, it's like humans. We're like, okay, who's gonna love us like that again? I think that's what it is. And we have similar things too, how you go in there and you hear, their life story. I do that too with hospice. I don't just go in there and, just start talking about, morphine and Ativan and all these things, or that it's, looking at the family pictures on the wall and learning about the family, because it is a privilege. So yeah, let's talk about that a little bit more.
Sure. You mentioned difficulty of adopting a pet again. So that was the other thing. What was the first thing? Remind me.
Delaying, things.
Oh,
You
delaying.
mentioned there's
Yeah,
a movement. Yeah.
it's what I find in my practice, and I believe I've euthanized now almost 2,500 animals in the last 3 years. So I've really experienced the whole humanity of what can be out there. And I find that the client that's already had an animal that they euthanized previously, and they waited too long, the next one, they're on the mark, and there's always a window when the animal enters the dying process. There's dying, and then there's active dying. In the dying process, things start to turn off. The appetite starts to go down. The owner notices that the animal's starting to have odd behaviors, cognitive decline, or they're just not able to enjoy life, and they're not sleeping a lot of times. That's really the time when you want to prepare to let them go. If you get into the active dying process, which happens, and I'm okay, I don't ever judge anybody, because these things can come on so quickly, as I've experienced. But then it's more of an urgent thing, and so a lot of us in this work do hopefully can come out and help with that. And if they can't, then they're going to have to go to the emergency room, you know, and assist. But it's hard, and it's really hard because, as they said, we're so attached. And sometimes I've met people that their strongest relationship with any living being was with their pet. And that's okay. You know, I mean, in some cases, that's what humanity is about, you know, and especially with people that have AIDS. When I've met people, they just didn't have anyone in their life. They just had their pets. And so I try to respect that, you know, but as for saying that they're never going to have another pet, I think that sometimes their connection is so deep, and it's like their heart is so broken that that's how they feel in the moment. And I, again, accept that, and it's okay. I have friends that have gone through that, but also sometimes you can't plan it. You know, sometimes a new cat just pops into your life in the backyard, or, you know, a dog comes into your life. So, you know, I think that it's okay either way, you know, and and of course, in my case, when I lost my last dog, it took me and my husband a year to be ready for another animal. You know, you can't replace them ever. They're never going to be the same, you know, and that's the beauty of raising animal companions. You know, they come to us with different experiences as puppies and kittens, and they're born differently, and they tend to keep those traits through their whole life, I find, you know, and it's just like people, I guess. We're sort of born with some of our personality, and I find it really curious to get to experience that.
I love that. Well, let's tell our audience about some valuable resources. I know that, you know, your personal website is under construction, but you had some things that you mentioned, like Muttville and the
Sure.
other websites. So some places where people can explore, because and I'm saying this because, and people may be surprised that I'm this way, even though I'm a hospice physician. But it shows, you know, we all have, you know, some anxieties and fears surrounding death and things we don't understand. And so my goal here is always to normalize things, to give people education so that they know how to navigate these processes, and so that everyone can have a good death. And before I go to that, you know, a lot of times I've seen human families or patients say, hey, can we just end this? Or euthanasia. We do have medical aid in dying that is legal in the United States, in certain states and DC. We do not euthanize humans, but it comes up. It comes up, you know, people will say, hey, you know, we treat animals better than this, you know, when they're seeing, you know, their family member decline. Any comments on that before we get into the valuable resources?
Sure. No, I think I get asked that as well. You know, I mean, I think about it, you know, and I, um, I do think that the assisted suicide is a good thing for some people, but it's not the end all, because a lot of times people get too sick and then they can't really end their own lives. You know, there's a lot of rules around that. I remember knowing the president of the Hemlock Society back in the 80s. He was a man with AIDS. He was planning his own death, and then he got so sick that he'd had to die, you know, unconscious at his home, you know, and so there's stipulations for people, and probably for real reasons, you know, but I do believe that our animals, offering our animals a kind euthanasia, allows for humanity to understand that it's okay, that endings are a kind thing, and that if we can, and I believe that our animal companions that's one of the last lessons they teach each of us that have animal companions. We can learn so much moving through that obstacle. As for resources, I do want to talk about Muttville. That's an organization in San Francisco that I'm really supportive and involved with, and they basically adopt out older dogs over than 7, and a lot of times they're people that have died in hospice or die, you know, that were not able to take care of the pets, and so there's a whole community of people that want to adopt out these animals, you know, and so Muttville is an amazing organization in San Francisco. You can Google their name, and they have a lot of resources about older animals on their older dogs on their page. If you want to learn about different grief resources and end-of-life resources and books for children, you can look at the website A Gentle Rest in San Francisco. That's where I work with Dr. Ari Waziki, and there's a great resources there. I'm creating a website called A Beloved Farewell. I'm going to be putting some of my own resources on there as well in the future. And also then I just want to talk briefly about the University of Vermont's Companion Animal Death Doula program. When I found that course, I just couldn't believe it because it was speaking to me as a person, as a veterinarian. And it turns out it had just gotten started right at the beginning of the pandemic. And it comes out of the human world, of the human hospice world, you know, and realizing that there's also a need to help people during the transition of end of life in some cases. And so there's a lot of individuals that take this course that are trying to find a space in our society. We're all pioneers, you know, and so there is no rules in the sense of and I'm trying to bring this into the veterinary profession. I'm giving a lecture at the AVMA conference in July, just trying to share that we as veterinarians and veterinary community already do death doula wisdom and so I'm just trying to empower us to know that that's who we are and that we can be better at it. Even in the clinic, you can create chapel rooms or special rooms where euthanasia is taken so that there's less anxiety for everybody. Make sure you support the staff, because that's a whole nother I mean, it's really hard, you know, and I believe that some staff could become end-of-life navigators, where if they realize the benefit they're doing, they can become empowered to help people in this moment rather than it being a stressor, you know, and that's really where it's hard. There's also all the people in the animal shelters that do have to euthanize healthy animals. That's a whole nother discussion group that we can talk about, but they need support as well, and doulas try to help them as well. So if you're interested in that program, just Google University of Vermont pet doula program and it will pop up. And so those are the resources I have.
All right. That sounds amazing. And then also, thank you for just covering. You just cover everything, having to euthanize healthy pets, you know, the rescues and all that stuff. Animal control, I should say. Thank you for all this. I'm going to have to digest this myself. You really dropped a lot of gems and created a positive, you know, framing for how we love our pets and also lose our pets when it's time, and release their spirits. I don't know what to say except thank you. I appreciate this, and I'll leave you with the last words. This is a gift for, you know, patients, families, vets. If there's any vets listening, yeah, thank you. That's all I could say. But I'll leave you with the final.
Yeah, Dr. G, thank you so much for inviting me to this moment. I think that at the end of life, it's about humanness, you know, compassion, and just and personal support. You know, we have to support ourselves. But I think that if we all can be, not all of us can be there, but if we can lean into this work, it gives you so much back. You know, that's what I find. I don't, you know, I'm only with clients for an hour, but that hour is like a sacred moment of just being present, you know, and that's what the doula spirit's about, is just being present for the animal and the people. So thank you for inviting me.
All right. Well, we're going to sign out in this episode of Dr. G at the Heart of Healthcare with the other Dr. G. Thank you, Dr. Ken Gorczyca. And we're signing out. Peace, everyone.